The government remains shut down tonight as Democrats try extorting Republicans over Obamacare subsidies. The failed signature of Obama's term at the height of COVID under Biden in 2021, Democrats passed the American Rescue Plan, which just temporarily, they said, extended free government help to pay for insurance, so government money to pay for insurance to people with incomes 400% above the poverty level. Yet families making $500,000 a year that were getting help from the U.S. taxpayer to pay for their health insurance. But now Democrats are refusing to let those subsidies die and claiming that any cutbacks to this is going to double premiums and kill thousands of people. Take a listen.
We're fighting on behalf of the American people and what they pay every month for health care. It's a worthy fight.
Unfortunately, Republicans refuse to sit down to negotiate an extension of the Affordable Care Act tax credits, and they have no interest in addressing the health care crisis that they've created.
Studies show that when you throw 15 million low-income and working-class people off health care, 50,000 people a year will die unnecessarily.
All right, Dr. Mehmet Oz, Medicare and Medicaid Services Administrator for the Trump administration, joins us now to talk about this. Sir, it's good to have you on. We keep hearing the same talking points. The government's been shut down for a while. Give us, what do you think is happening here? What are they trying to do?
I think the Democratic Party is in a free fall. They keep making up different bits of data every time I hear interviews. Let me just give you some new data that's actually driven by analysts who deep dived into the reality of one of the big themes that we're talking about here. The shutdown ostensibly was also going to be requiring that we change the one big beautiful bill, the legislation that was so important in cleaning up the fraud in Medicaid. And just to be clear about this, there was fraud, we argued at the time, that was allowing federal tax dollars to pay for illegal immigrants around the country to get free health care. We were told that wasn't happening. We were making it up. And finally, we just got our best people on this job. Just got the data back. Are you ready for this, Rob?
Yeah.
The amount of money just in the past few months from just the first states that are in this program being audited, over $1 billion. Imagine that. $1 billion, that's with a B, of money spent from U.S. taxpayers in just a couple states who refuse to deal with the reality that they are insuring illegal immigrants. So take California as an example. They are very proud to pay for full dental, vision, all kinds of services for illegal immigrants until they have to pay for it. But it's not right for taxpayers in Texas and Florida to have to ante up extra money to pay for that debt. And they keep changing the topic whenever we try to focus them in on the reality. What they want for this shutdown is to get rid of all the fraud, waste, and abuse safeguards that we put into place, working hard, just voted in the law. I just don't see an off-ramp for them. I have no idea why they're doing it. It doesn't make sense other than pure political.
What do you do with Obamacare that they've been trying to save forever? It obviously doesn't work. The funding mechanism was the mandate on the younger people that it was unconstitutional, so now they don't have that money coming in. What the hell do you do with this thing? It obviously is failing, but nobody wants to say it.
Well, the ACA is having big issues, but to even begin to address those problems, you need to have people in offices at CMS working hard with better ideas. If you furlough your staff and you shut the government down, you're not going to get better ideas. You're going to get no ideas, which, again, I think is part of the calculus. They don't have any game plan. And I should point out, despite what I just said about being down on manpower, we still have open enrollment season for Medicare. If you're Medicare age, I just joined, by the way, just turned 65, go to Medicare.gov or 1-800-Medicare. It's your social safety net program at crown jewel. No Republicans are touching it. No Democrats are touching it. It's intact and ready for you. Take advantage of it. Open enrollment.
Happy birthday, Dr. Oz. Looking good at 65, my man. We appreciate you coming on. Good to see you. You know, everybody's reporting the same stories, the same spin. You turn the channel, it's always the same. But not us. We're different. We report the real news. No spin, just the facts. Turn to us, and you won't turn back.
Tune in to Rob Schmidt tonight on Newsmax.